Could antibiotics prevent COVID-19? COVID-19 can be said to be sepsis with no highly effective antimicrobial therapy. Although we are unlikely to ever see a trial that will compare antibiotics, whereas no antibiotics in bacterial sepsis. Kumar et al. Kumar et al. Provided the closest evidence to that scenario. The mortality rate of patients with septic shock who received inappropriate antimicrobials bordered 90%. Those patients who received appropriate antibiotics have a 5-fold mortality rate reduction. The mortality rate of the inappropriate antibiotic group is similar in magnitude to the 88% mortality rate reported in patients with severe COVID-19 and mechanical ventilation. The patients with COVID-19 couldn't receive appropriate antimicrobials because such therapy for SARS-CoV-2 didn't exist. No currently active physician has practiced in an era without antibiotics to treat bacterial infections, but the circumstance that we describe brings to mind reports from that era. Before the advent of penicillin, pneumococcal pneumonia conferred an 84% mortality rate in patients by 70 years old. Bacteremic pneumonia in that age group was uniformly fatal. Antibiotics were not the only medical treatment lacking. ICUs, mechanical ventilation, and the ability to assess for VTE or disseminated intravascular coagulation were non-existent. However, it is highly likely that without antibiotics, these other technologies could be only partially effective. For more videos, subscribe our channel, share our videos, and leave us comments.